Why do some people believe that medication they are prescribed or the magic pill is isn't the answer to their problems? I know there's a lot of people out there who are still very worried about getting medication prescribed, going down the trend of fear in the health world of what doctors are prescribing. Do people really have this fear? And why not just take the medication to really answer the fear that they're having?
I think the first problem that comes in, I don't think it's much of a fear, but yeah, or I don't know what I'm putting in my body. I think when it comes to psychotropic medications, for example, like antidepressants, we have tons and tons of years, over 50 years of data showing that this stuff is helpful, it's beneficial, and it's neuroprotective. It protects neurons. But I think one of the major, hesitations that people have to getting put on, especially psychiatric medications, would be compliance. I don't think the idea of taking the pill is as scary as I have to do this every day for who knows how long, possibly the rest of my life. And I think it comes into the point of, I don't want this medication to control me. I don't want this to be something that I'm doing every single day for the rest of my life or for the next 10 years, for example. So it's a major question. I think what the hesitation comes in is of compliance. A lot of patients, from what I've seen, like to take things PRN, as we like to say, as needed. And it doesn't really work like that with some, psychiatric medication like antidepressants. You need at least 2 weeks of antidepressant, of regular use on antidepressants for them to at least have some type of an effect. So I think the major fear is compliance. I don't want to be controlled by something. I don't want to take something for an extended period amount of time.
And where control comes in, I believe, makes a really good point because my father has to take lots of medication for his heart. And so I think the one thing he always complains about is I have to go take my pill. I have to go take the next pill. I have to go and get them refilled. And I have to continue this life cycle because it keeps him alive. And so I do believe where Dr. Tadayyon is saying that control plays a factor in how we look at medication. Brandon, do you feel as if control would be the issue, or do you believe there's like another issue why people won't take that magic pill?
I feel like why some people would not take that magic pill is mostly likely the side effects. Kind of like how you describe how like your dad has to take medications for a heart. I think I could kind of say like with my own mom. This was a while back. I want to say 5, maybe even 5 to 10 years ago. I remember my mom was working at the bank and she fell down the stairs and she fractured her leg. But then the prescription or the pill that they put her on was a Xanax, just so it could help her with the pain and things like that. And at first she did take it and it did help, but the only thing she didn't like about that pill was that the side effects that it gave her basically made her feel like a zombie, as she always described to me. And like I could notice like on a daily basis how her mood always changed. Like she wasn't herself. When it's low key, that kind of scared me in a way because like I know how my mom is and how she's around the house. Like she's always up and going. Like she's always conversating things like that. I know how she is. But then just seeing like that slightest change from the very beginning when she first took that pill, and then weeks and weeks going by and have to take it, like it just completely changed her in a way. So I guess like things like that will make people not want to take the pill. And I mean, even for some people, like for example, if they were to take it and feel like 100 times better and things like that, and they feel happy, like I feel everybody is different with their body chemicals and things like that of how they react to the pill.
And when you see somebody change too after medication, you're kind of like, it kind of gives you that, like, okay, I don't really want to take medication now for anything because I see what I'm seeing in another person kind of affects how I feel about it. And especially if you have someone who's going through life and death experiences with medication where it saves them and needs to keep them alive, you're kind of like, it's so hard, like
Yeah, I
because
could see that.
like 1 second you're so excited about like whoever it is to stay alive because of the medication, but you see them change too because it does change the chemical imbalance in their brains. So with your experience with medication, Will, I know that you went through this whole beginning process of the magic pill being the answer. Was the magic pill the answer?
I mean, it takes a long time. Like, yeah, a lot of the medications. I so through my experience, I have been on medications like that where it was like very mind suppressive, and that's fine. Like some people like need that, and that's okay. But I didn't like that, and that's all it took for me to say. Like I said, like this is not the one. I don't like that. There are thousands of medications to try. And they will just try something new. If and they were very receptive. You know, you can talk to them for 30, 45 minutes if you want to, and they will say, like, we'll get down to the core root of like what the issue is, and try a different medication. For me, on this like controlling factor, it wasn't just like I never really thought like, okay, like like if I didn't like the medicine, I just didn't take it. I tried a new one. Like it was fine, and it was just the process of finding them. With a lot of those medications, it just takes like usually what he said with like SSRIs, they need to be in your system for a certain amount of time. Usually, like a baseline, I would say a good 2 weeks before you like will start seeing the effects or the benefits, the downsides, like anything like that. It just needs to build up in your system. And so like how I would schedule like appointments is it would be on a monthly basis because that first 2 weeks is a build up, and the 2 weeks after that you're really experiencing how this medication works. And for me on the controlling side, it was just like it took me years to find the correct medication that I felt suited me. And through that experience, like comes with like, so sometimes they would send over a pill that wasn't on my insurance, and it would be hundreds and hundreds of dollars. And all they needed to do was just change like it. Like they have a bunch of off-brand stuff too. They could have just said, "Oh, send this; it'll be like $4."
Yeah.
But like they don't know that, like they just send the medication. So like there's other issues internally like that where like, oh, you have to call them back and say like, that's too expensive. Like try a different one. Sometimes it's like I said, it's just the wrong medication for you, and you'll call them and you'll just stop. But like you still have that appointment set up maybe 3 weeks from now, and you have to wait to go see them again and try something new. So it's a trial and error. It's a process of trial and error. But honestly, like where I'm at now is the benefits outweigh all the negatives that I've gone through with it. Like I have the medicine that I like, that makes me feel as much me as possible, and that journey is worth it.
And I totally agree with you on that.
So the next question that we asked him is medication a last resort, or is it usually the first step in making a decision whether medication is right for you or not?
That's a great question. I think the answer to that question depends on the person. For example, if somebody, let's say hypothetically, somebody's dealing with a significant amount of depression throughout their life, they have the inability to really construct the future. They have difficulty finding joy in their life. So, what would be the first step for them? Well, what would they be comfortable with? If we're making major steps towards changing your perspective on life, changing your outlook on life, you have to be comfortable taking those first steps. So some people might be comfortable with starting, medication, starting an SSRI daily, and then checking in with their psychiatrist in 30 days from now. Other people might be a little bit hesitant on starting a new medication, but they might be open to the idea of cognitive behavioral therapy. And that might be the best bet for them. So really, what really matters most is what is most comfortable for the patient and what the patient feels is going to be the best step for them. So some might start out with medications, some might start out with cognitive behavioral therapy, and then they can be adjuncted. For example, if somebody participates in CBT but doesn't find that much relief and wants to add more, then what they could add on is medications. Or if somebody starts on with medications, doesn't seem that much relief, what we could add on is CBT.
So, for the listener and viewer, I want to explain to you what CBT really quick is. Therapists, they go through different theories, and there's many different theories that they can go through. There's play therapy, there's DBT, dialectical behavior therapy, there's CBT, cognitive behavioral therapy, and EMDR, eye movement desensitization and reprocessing. There's many different theories, and many different therapists use many different theories, but the main one is CBT. And CBT pretty much is reframing your mind to think about things in a different light and a different opinion. So, not allowing yourself to stick onto one topic and telling yourself things. It's reframing the way that you see and the way that you maybe even see life. A lot of therapists enjoy CBT because a lot of clients achieve their goals in therapy with CBT. It's just a quick explanation on what CBT is. Um, in my experience in therapy and with the therapists I've conversated with is CBT is extremely helpful. It's something that if you do want to go to therapy, I definitely recommend you talk to your therapist about what theories they go through and then researching those theories, because you want to make sure that sometimes some theories don't work. And every case scenario is different. And so we definitely recommend to the listener and viewer, do your research and maybe even ask your therapist what kind of theories they plan on going through or what they specialize in. Very important. But like he was saying, it's kind of we're in this medical world now where your opinion kind of goes into two different directions. Cheyenne, I know that you have not had the experience with medication, maybe not had the experience with CBT, but when you're in a decision making process, what do you think like helps the person benefit more? Do you think people like want to go towards medication? Do they want to go through to therapy? Is it difficult, would you say, if you were ever in that process to try to choose the route?
I think it really just matters on your upbringing and what type of medical practices your family uses, or what just whatever they do. Because I know on my mom's side, she likes very like holistic doctors and like Eastern medicine practices. So it really just depends on what you're comfortable with, what your family has introduced to you since birth, and I mean, I think really that's what factors in on the decision making when you want to decide whether or not you go to therapy, whether you take Western medicine, whether you take Eastern medicine, just whatever works for you.
Yeah, and I totally agree, especially when your environment and how you're raised kind of shapes about what kind of direction you'd rather go in, which is either go through and see a therapist. Because I do know in a lot of families, and I just want to mention, I saw this really funny tweet. It was about this woman who would say, "Oh, mom, I'm going to therapy," and the mom was very what's it called? The mom was not ever had heard of therapy, and whoever she spoke to about therapy was quote unquote crazy. And so she asked her daughter, like, "You're not crazy. Why are you going to therapy?" So in
That's
different,
severe end.
yeah, different
Wow.
international countries, we all look at therapy sometimes as this person needs a lot of help. And I think the issue with therapy is looking at many difficult disorders such as schizophrenia, multi-personality disorder, bipolar disorder, these disorders that are very like that have a lot of mental effect on the person, and people quote unquote call them crazy.
Hmm.
However, I do want to let the listener and viewer know that you are not crazy for going to therapy. It is your decision, and I believe in it 100%. And if you want to go either route, whether Will here has done the medication route, I've gone through the therapy route. Many people different go through different routes onto what they believe, but never allow someone to make you feel like that you're viewed in a different way because you go to a therapist. Because there's many people who do, and there's many people who come back and say that they're doing 10 times better than they were.
There's so many
Yeah.
different types of therapists. Like it
Exactly.
doesn't mean anything.
And so remember, not only that you are not crazy, you are just a person going through different chemical imbalances. And if you believe that medication could be a route for you, we definitely find that talking to your doctor or listening to our podcast can not only give you the information that you need to make your decision, but hopefully in the end that the decision you do make is the right one for you. And don't worry about going with medication and then switching to a therapist, because I've seen a lot of that too.
Yeah.
Medication tried, didn't work. And I've also seen people go therapy, didn't work, and go to medication. There's two routes in front of you. Definitely figure out which one's right for you, and we'll go from there.
Yeah, and even with CBT, like we didn't directly address it on like the last episode of bouncing back, but we
Mhm.
talked about it. It's basically what it is, changing your negatives to positives. And I've seen a lot of people, even people here who didn't go the medication route, who use that. Like you don't even necessarily need to see a therapist to get the benefits of those things. So you can also do personal research. But just like Sina said, like listening to our podcast, getting good information from any sources that you can find. That's like where it really just starts. As long as you just start it, you'll figure out on your own what you think, and then that's where you can begin to try things.